This is Dr. Scott Boden with the Hair Restoration Center of Connecticut, and very happy to introduce you to a patient of mine named Lee. Lee is a healthy 40-year-old man who had a procedure with me 14 months ago. Healthy, active man, 2 young kids, had hair loss in a frontal distribution, would be a Norwood category 5 anterior, 5A, and was motivated to not have to spend as much time working with his hair every morning and wanted to just look natural. So I think we accomplished a great deal. We did one procedure 14 months ago. We'll take a close look at his hairline. We did about 2,100 follicles. He preferred to keep his hair somewhat long, and so we did the linear extraction, and technique worked out fine for him. He says he can cut his hair to a number 3 or 4, and no one sees any kind of scar on the back, but he's comfortable leaving his hair a little bit long. He's very comfortable with the naturalness, and I'm comfortable with the density with a single procedure. Basically, Lee obviously didn't start out as a bald guy, but the transplant really involved reinforcing this frontal third, and this is essentially all transplanted hair, and it really looks natural. That's the ultimate goal. There's a thin line back here from where the hair was taken because he did the FUT procedure, the linear extraction procedure, but you healed really well. I'm combing through here and it's hard to even see anything. I will say, as I say to every patient, I stress the importance of maintaining what they have. So he's using extra strength minoxidil. He has a laser but doesn't use it consistently. He's using a 5-alpha reductase inhibitor, meaning finasteride or dutasteride. And we also discussed some natural DHT blockers. So he's doing everything on his part to maintain what he has. We did one very successful transplant, and from here the care is just as you normally would. You shampoo and comb and get haircuts, and this should last a lifetime for him.